health correspondent Nicola Hill joins us now for more in London. Nicola, good to have you on the show. In terms of sort of the UK stockpiling on these potential vaccines, I mean, is this a case of maybe getting the cart before the horse? I mean, why has the UK ordered so many and so different types of vaccines?
I think, Alijan, it's a bit like spread betting here, isn't it? They're sort of putting bets on each of these 6 different types of vaccines. Of course, there's many more than 6 that are the front runners at the moment. But Kate Bingham, who heads the UK's vaccine task force, has been speaking to the media today. And she says they've chosen what they think are the 6 most promising of the 4 different types of vaccine candidates that are being investigated. And I think at the moment they've actually got orders in for 314 million doses. So if all those vaccines work, that would be 5 doses for each person. But what Kate Bingham has actually said is that at the moment there isn't a vaccine that works against the human coronavirus. They don't know which one of these 6 are going to work, but they want to be in a position that they hope they've got one that does end up being effective. Although she has also said that there might be a different vaccine for a different population group. That's not her responsibility to decide who gets which vaccine if more than one of them is effective. That'll be something that will be decided by vaccinologists and immunologists. And one of the questions that we asked her was, sort of, is this vaccine nationalism? In other words, sort of keeping all these doses here in the UK, stockpiling them, so to speak, perhaps following the indication that President Trump did in America, where he sort of bought up so many doses of remdesivir, the Gilead drug that's actually being used to treat people. Now, Kate Bingham said that's not the case, and if we end up having, if we end up having any spares here in the UK, they will share them because, of course, as she says, the virus is a global problem, and you can't just vaccinate people in the UK because there's so much movement. Well, hopefully there will be so much movement in the future, people moving between countries, so you need everyone to be vaccinated.
Okay, I have about a minute left in the segment, but I mean, is there any indication which one of these 6 is most likely to succeed?
Well, a lot of hope's being pinned on the Oxford one, with the head of the Oxford Vaccine Group saying that should be ready by the end of this year. They're hoping that might be the case. They're hoping that the Novavax one might be quite quick. J&J have said they're going to have 1 billion doses ready by the beginning of next year. But no, the answer at the moment is we don't know. It's very much watch this space.
All right, our health correspondent Nicola Hill live for us in London. Thank you very much for that.